Hi, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. Youth sports was the focus of this week's Questions for the Ask Dr. Echols segment. Brian asked, what guidelines are in place to reduce the risk of contracting and spreading the virus? Face covering, social distancing, hand hygiene, and cleaning and disinfection guidelines are some of the health and safety procedures that are in place. Regular testing of athletes and coaching staffs participating in high and moderate frequency contact sports will also assist in reducing the risk of athletes and coaching staffs contracting and spreading COVID-19. Screening prior to athletic events and practices is also key. Every coach, athlete, or essential individual must be screened when they enter the campus or facility where the sporting activity will occur. They will be asked if they have experienced certain new or worsening symptoms within the past 24 hours. If an athlete, coach, or officials answer yes to any of the screening questions, they will be sent home immediately and told to follow up with their medical provider. Pamela asked, I read that certain athletes in the city of St. Louis must undergo regular COVID-19 testing. What type of tests are acceptable? Current scientific evidence indicates that youth are more likely to remain without symptoms while infected with COVID-19. Testing is essential to identify youth athletes who are infectious and is required for youth and coaching staff who participate in high and moderate frequency contact sports activities. At this time, testing is not required for low frequency contact sports. The following specimen types are acceptable. Nasopharyngeal specimens. The specimen is collected by inserting and rubbing a swab on the inside of a patient's nasal passage. Oropharyngeal specimens. The specimen is collected by inserting and rubbing a swab in the rear of the patient's mouth. However, due to the increase in potential transmission during collection, this is the least preferred method. If a school fails to use a PCR test and approved collection method, it may lose its approval to compete. Schools shall ensure students and staff health information is collected and stored in compliance with federal and state regulations. Brittany asked, why are there attendance limitations for sports competitions? Due to ongoing widespread community transmission of COVID-19, it is recommended that persons not essential for athletic activity operations, including spectators, volunteers, parents, guardians, or non-essential visitors, not be allowed. However, the City of St. Louis is sensitive to family dynamics and aims to minimize the burden that may be caused by COVID-19 mitigation strategies. At most, each athlete shall be allowed 2 guests to observe gameplay. However, these guests must comply with City of St. Louis face covering and social distancing requirements. Failure to comply with these requirements may result in the child not being allowed to play for the remainder of the season. Terrell asked, are certain athletes or coaches at higher risk of severe illness from COVID-19? Yes, some conditions increase an individual's risk for severe illness and complications. Athletes, coaches, parents, and guardians should consider delaying the athlete's participation in sports and athletic activity if the athlete has any of the following conditions: liver disease, chronic lung disease, including moderate or severe asthma, type 2 diabetes, chronic kidney disease, sickle cell disease, not sickle cell trait, heart conditions, or immunocompromised. Parents or guardians who have children with these risk factors are required to consult with their healthcare provider about participation in sports since limited data exists. Coaches and other staff must also exercise caution in attending youth sports activities if they have any of the above identified conditions. Thank you so much for tuning in this week, and thank you to everyone who sent questions about youth sports and COVID-19. Be sure to tune in next week for more critical public health information. I want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.